Hello, my name is Sarah Byrne-Martelli, and I am the OCamper Secretary. And I'm so happy to welcome you all to this presentation, which is called Treating Children and Adolescents During the Pandemic by Dr. Lila Amirali. And so she can introduce herself more, but briefly, I'll just say she's a child and adolescent psychiatrist, and she's the chief of the Department of Psychiatry at CHU Saint Justine and associate professor at the University of Montreal. And she obtained her Master's of Management from McGill in 2014. She works in the inpatient service and in the research center of St. Justine. She's also chair of the Child and Adolescent Specialty Committee of the Royal College of Physicians and Surgeons of Canada, and the vice chair of the Canadian Academy of Child and Adolescent Psychiatry. She's also the president of the Association of Child and Adolescent Psychiatrists of Quebec. So with that, welcome, Dr. Amirali.
Thank you, Sarah. Thank you very much for the kind introduction. I would like to first say that I'm actually quite upset that I'm not there in Phoenix with all of you, where it is nice and warm, and especially because I'm missing the fellowship, which is so important for all of us, especially now during the time of COVID. I had, in terms of disclosures, I don't have any conflict of interest to declare about this presentation. And I had prepared this workshop as actually more interactive, and I'll try to do my best with those of you who are present to see if we can have a discussion, so feel free. If there is anyone that is on the chat, feel free to ask your questions or your comments on the chat. I'm more interested in the comments and the interaction, but we'll try to do our best under the COVID circumstances. So in terms of my objectives, I would like to describe the effects of the COVID pandemic to the mental health of children and adolescents, describe the experience of caring for COVID positive children and adolescents who had to be hospitalized for psychiatric reasons, and finally, hopefully throughout, but finally share reflections and comments with you about some of these observations and how do we see them as Orthodox Christians in the church. First, if you don't mind, those of you who are present, if you would tell me, what is your line of work, and do you work with children, adolescents, or youth? And did your work change during the pandemic? Feel free to unmute yourself and please say a few words if you wish.
And you can feel free to type into the chat too, this information. We'd love to see kind of what everyone's working on.
Okay, I'll go first because I like interaction. I'm Nermeen Gorgi. I'm actually a family doctor in Toronto. Hi, fellow Canadian. Hi. And I do psychotherapy. Generally, I don't work with children, but because of the incredible demand, thanks to COVID, I do have two 16-year-olds that I am seeing for psychotherapy. I won't go younger than 16. I've been asked. I won't go younger than 16, but I have a bunch of 18-year-olds and a couple of 16-year-olds. And I can't remember what were the other questions, so stop here.
Very, very interesting. Welcome to a fellow Canadian who understands how much envious we are of not being able to be in Phoenix today.
Yep.
And I think that I will bring up some issues about, the treatment during the presentation, and feel free at that point to, if you want, lift your hand or something, I can stop and we can discuss a little further, because that would be very interesting. I don't have very much on therapy today because I didn't know what the interest would be, but I would be very happy to discuss it during our time here today.
Thank you.
Thank you, Nermeen. Anybody else would be interested in presenting or saying something about themselves?
I'm trying to navigate all the buttons. I'm Carly Frederick, and I am a pediatric nurse practitioner and a psychiatric nurse practitioner. And when we were talking about COVID fatigue, yep, and have seen a lot of an increase. Of course, we're in a crisis. We talked about that, Lila, a little bit before we started. I know you're going to talk about it, so I'm looking forward to hear more from you.
Thank you very much. Thank you, Carly. And I'm sure that what I will present in terms of data may not be new to you, but it will be fun to share some of the experiences, and I'm looking forward to it. So I guess I will continue, and feel free to, if you prefer to write a comment, if it is easier or whatever, and Sarah can let us know. So the impact of the pandemic is, on different levels. And I would like to discuss briefly 3 different levels. One that has to do with psychiatric services and access to mental health care for children and adolescents. Another one, which is about the transformation of services and practices and how we had to change our ways to respond to the pandemic. And finally, more general comments about mental health and COVID-19. So here it is, Carly, what you were talking about, the declaration of a national emergency of pediatric groups over children's mental health from the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association, urging lawmakers in a statement, it was actually published on the Hill, to act swiftly to address this crisis. And, the words are quite serious. Children's mental health is suffering. Young people have endured so much throughout this pandemic. And while much of the attention is often placed on the physical health consequences, we cannot overlook the escalating mental health crisis facing our patients. This declaration is an urgent call to policymakers at all levels of government, and we must treat this mental health crisis like the emergency it is. I feel, and I have said it on different presentations, that I feel that if there is a silver lining on this pandemic, is the awareness and the light that it's shown on mental health, and especially on youth mental health. Already at the very beginning, back in August 2020, more than a year ago, we had from the New England Journal of Medicine the articles that came out speaking about the uncertain prognosis, the shortages of resources for testing, treatment, the public health measures that were taken, the financial losses for a large portion of the population, and the conflicting messages with the uncertainty that contributed to a great degree to this mental health crisis that we're facing. Now, in terms of psychiatric services, I know very well the reality in Canada, and Nermin, feel free to add to that. But I'm involved with the American Academy of Child and Adolescent Psychiatry for many, many years. I've been a member and part of different forums. And I know that I speak for all North America when I say that there is a major lack of resources, both in terms of child and adolescent psychiatrists, as well as qualified professionals. I'm glad, and I don't know how many qualified nurse practitioners there are in the United States. For us here in Canada, it is a new, actually this year, we have the second graduating class in Quebec of nurse practitioners. So it is new, but they are not enough. There is no way that we have enough. There is a youth protection system which is overburdened, and readaptation system which is also overburdened. And services for autism and developmental disabilities are actually also overburdened. The other issue is that there are great disparities in the distribution of resources, especially in terms of mental health and of youth mental health. And there is a lack of support to vulnerable populations. In terms of after-school care, crisis services, all these really vary from area to area. And another chronic issue is the multiple silos and the coordination that is lacking, the collaboration and the lack of continuity in the community. So the COVID pandemic came, and we faced issues on multiple levels. In terms of individuals, there was right away a level of insecurity, confusion, emotional isolation, stigma. There were the community issues, major economic loss, work and job security, closures of all kinds of activities, inadequate resources for care, responses that were complicated, deficient distribution of equipment and of even of vaccines, even of appropriate measures. And then we have multiple factors to consider when we're looking at children and adolescents. There's a developmental level. The impact of COVID was very different for young children, different for adolescents and young adults. Then there are the temperamental and personality traits that actually play a very important role. Not all of us react the same way to crisis. Of course, one more important issue that I would like to discuss with you, and I would really like to hear your comments and exchange, is the relational issues with parents and primary caretakers. This is a very, very important issue that hit us in the pandemic, and the social determinants of mental health. I would like to stick for a couple of minutes on the social determinants of mental health as declared by the APA just last year. Unfortunately, the pandemic shone light to the discrepancies that we face as societies. And unfortunately, all major issues hit people who are the most marginalized and have the most difficulties, actually more than anybody else. And the pandemic brought to the surface issues that we're aware of, but showed us how much difficult it is for people who have social adversity, for people who face issues of racism, who have adverse childhood experiences, who face discrimination or social exclusion for whatever reason based on race, ethnicity, gender, age, mental illness. Also the health inequity that the population faces and the unequal access to care, the exposure to violence and the criminal justice system, economic factors related to resources, people who live in poverty, who have a lack education, whose employment was affected, are the ones who were most affected by the pandemic as well. Then there are the built environment factors, and those factors are some of the ones that our youth today are a lot more aware, but housing, air pollution, water pollution, climate change issues, all affect the population, and all of them affect mental health, and all of them contributed to the pandemic issues that we faced. Finally, structural factors that include cultural norms, systemic policies, laws and regulations that institutionalize disparities for populations such as Black, Indigenous, Hispanic, rural, other minority communities. All those are realities that we have to face, and the pandemic brought them to the surface and made us not to be able to close our eyes, especially as we stand both as mental health professionals or as parents, as caretakers of youth in any way, and as Orthodox Christians. So here is from one of our newspapers. The situation is touching a lot of young women more than men. This comes from Quebec, from Statistics Canada. School was very affected. You see here different ways that schools try to cope with distancing, with the screens, the transparent screens. And this that I found, actually, this is a real picture from a university in Japan, a school of management, where, as you can see, the iPad is replacing the face of the student who is receiving their diploma, their degree, in distance, and only the faculty at the back is attending. From the very beginning of the pandemic, we became aware of the effect of COVID-19 on youth mental health. You see here, in Nature, an article that came out in April already with Chinese data. And then from the JAMA Pediatrics, also from China, the effect on children in home confinement in terms of their mental health. So we know, and we knew from the very beginning of the pandemic, that certain factors, such as closures of kindergartens and schools, the fact that we were obliged to limit social contacts, the fact that leisure activities outside the house had to close, and the concerns about self-help, family, and friends, all of these were issues that were affecting the mental health of our children. And what were some of the problems that we saw from the very beginning? There were issues about anxiety, symptoms of anxiety, symptoms of depression, symptoms of post-traumatic stress disorder, maltreatment, abuse, domestic violence. In terms of parents and what happens to parents, well, the job loss, extremely important. The unemployment rates. In Montreal, we're very famous for our multiple restaurants and our, cuisine that is multi-ethnic and from all over the world. Well, many restaurants close. And when one restaurant closes, it is not only the owner or the family, many families leave from one restaurant. The unemployment rate was extremely high during the pandemic. And the financial difficulties have only started. The social isolation was also extremely difficult. And the loss of external support by other family members, or the social system, the support system that each one would have, was not accessible. Many parents, including many of our colleagues and the people that we're working with who have young children or even grandchildren, had to school them at home because the equipment that was necessary for the homeschooling was not as abundant in one household that has more than one or two or three children. So at the same time, parents struggling to work as they homeschool their children in the same household faced extreme distress. And those are some of the consequences of the changes that happened during the pandemic. There are many articles, and I present you some of them here, that talk about the challenges of caregiving and the caregiving burden in terms of mental health and how it impacted the parent-child relationship. The child maltreatment and the domestic violence were also increased during the pandemic, and this has not stopped yet. We still see the results and the effects. I would like you to notice this study, and I'm going to try and move our here so you can see better. I would like you to notice on household adult layoff, this from the Journal of Pediatrics. It affects right away parental negative mood very significantly. But you see, and it has an effect on parents' quality of sleep and on uncooperative behavior and worries of the child, but it is at the limit of significance. But look at the household income loss. Not only affects negatively parents' mood, not only affects parents' sleep, but it also affects child's behavior. When we go to increased caregiving burden and how the parent feels during that time, we see right away that it actually affects not only the parent's mood, not only the parent's sleep, but it affects greatly the child's uncooperative behavior and the worry of the child. Finally, member of the household falling sick affects the parental negative mood, the parental negative sleep, the quality and the behavior of the child, and the worries of the child. So this is a major consequence. And many children and adolescents fall into that category. As you know, during the pandemic, international rates of child and adolescent psychological disorders doubled in the first year of the pandemic. An estimated 1 in 4 youth across various regions of the globe experienced clinically elevated depression symptoms, while 1 in 5, 20%, experienced clinically elevated anxiety symptoms. This is a result of a huge meta-analysis of 29 studies where prevalence rates were higher when collected later in the pandemic, more recently, in older adolescents and in girls. And we see in this meta-analysis, we have more than 80,000 young people worldwide aged 18 or less. And we see that the estimates of clinically elevated youth depression are up to 25% as compared to 11% in large youth cohorts before the pandemic, for depression as compared to 12.9%, and for anxiety, they are up to 20% as compared to 11.6%. So doubled both anxiety and depression post-pandemic. Here you see one of those pictures that I found very intrusive, trying to clean the daycare in a Jewish daycare in New York, the military helping to do that. So I'm coming a little bit in our experience at SHU, which stands for Centre Hospitalier Universitaire, University Hospital Center of Saint Justine, where I work as the chief of psychiatry. It is the largest mother-child center in Canada and one of the 4 most important pediatric centers in America. It was designated from the very beginning as a COVID-19 center, and we received all the patients, the positive patients for the first wave from the entire region since the beginning of pandemic. We were the only hospital that actually designated a psychiatric inpatient services unit to COVID positive patients. In order to serve, we had to split our personnel, psychiatric personnel, to a non-COVID and to a COVID unit psychiatric patients. So at the beginning of the pandemic, in terms of numbers, children accounted for 6% only of all cases reported, this as of October last year, so about a year ago. And the main manifestations were mostly mild with very, very low mortality. In our hospital, we have a psychiatric unit with 12 beds, which are split in 8 rooms. So we have a couple of rooms that have 2 beds, and we have specialized staff, both nursing, psychoeducators, psychologists, social worker, and child psychiatrists. During the first wave, the COVID positive psychiatric patients that we received were mostly children and adolescents who were living in a residential environment. So we have many autism spectrum disorders with psychiatric comorbidity. We had children with genetic issues such as 22q deletion, of which the vast majority would be in the spectrum, in the autistic spectrum, and 1 in 4 will develop schizophrenia across their lifespan. We had children with adolescents with borderline personality disorder, many with relational problems, suicidal ideation or suicide attempts who were COVID positive, Down syndrome, and ADHD. This is not exactly the same prevalence that we see in our regular non-COVID unit. All of these children presented medical complications, and all of them had significant risks in terms of aggression, self-mutilation, agitation, physical deterioration because of their immobility. In terms of reorganization, we had to cohort not only our patients, but also our physicians, our professionals, our nursing, because none of us could work during the same 24 hours return to the cold unit from the hot COVID unit. So we had to cohort all the shifts and everybody. We had to ensure security and how we could run a code white, how we could have a secure and safe environment with all the personal protective equipment. We had to respect the guidelines and protect our personnel. At the same time, ensure proper medical monitoring and adapt all our psychosocial interventions in a way that we had never done before. Just to underline some of our statistics in terms of adolescents, you see here in red, this is anorexia nervosa and eating disorders, and you can see how the number of hospitalizations, of hospital visits increased significantly from March 2019 to March 2021. And you see here that the number of visits not only increased, but 40% of our pediatric beds are occupied by eating disorders at this point. So some of the issues that we had to face had to do with the social distancing, which increased which served both as predisposing, precipitating, perpetuating factor, and very, very rarely as a protective factor for psychiatric issues. We had to face in our unit, and when we were facing our patients, the absence of facial expression. We could not read the expression of our patients. We had to ask our orthophonists, our speech therapists, to borrow and use the same type of facial masks that allow, they're transparent and allow somebody to see the face of, allow the child to see our face in order to communicate better with them. We had to leave them, our patients, without a mask because they could not tolerate it. Many of them had serious problems and they could not tolerate the mask. They would not understand some of them that were nonverbal. Unfortunately, we couldn't touch them. So we were deprived of the communication that we exercise with children that are often non-verbal or they cannot understand, and often we would use movements and communicate with them. Many of all our staff had to be dressed completely and fully covered at the beginning of the pandemic when there were no vaccines yet, and they would have to remain fully dressed and only change their mask every few hours, their facial mask, throughout their shift. And this was one of the very difficult factors that staff had to face. So the COVID fatigue was equally physical as well as mental. They had to intervene and try to appease, try to, contain, try to ensure the security of these patients, while each and every one of us was carrying all this protective equipment for the virus. So some of the issues, some of the psychosocial assessment also had to start including a lot of issues around COVID. We would have to explore all related stressors around exposure to any source, infected family members, loss of loved ones, physical distancing within families, that they could not visit each other. We had to explore secondary adversities and economic financial loss, psychosocial effects of depression, anxiety, psychosomatic preoccupations, insomnia, the increased substance use that we saw in adults very often was an issue and often was the precursor of domestic violence that had to be explored explicitly for every adolescent and every youth that we saw. And also indicators of vulnerability. So in many levels, we had to change our approach. I have a couple of cases to discuss that we could discuss now or later, but I would like to just briefly give you an example of one of the girls that we had admitted very early on during the pandemic. I'll name her Melissa. She was a 16-year-old girl who was living in a residential setting in youth protection, who was admitted for suicidal ideation and severe self-mutilation and anxiety. And she was COVID positive, so she had to be admitted to a COVID positive unit. She also initially had mild fever and respiratory distress, fatigue and nausea, but they were not severe enough to qualify for pediatric setting. Melissa felt comfortable in the isolation of her hospital room, but initially the most important issue that we had for her was to engage her on any kind of psychiatric intervention or psychotherapeutic intervention. She actually found that she preferred to be isolated and not talk to anybody. She had the blinds in her room closed. She preferred not to have light, and she would rather stay just absorbed in trying to watch TV, which was something to which she did not have access in her residence. And we normally don't have access in our psychiatric unit, but these beds were in another part of the hospital that was actually the unit, the hot COVID psychiatric unit. So it took considerable work of all our staff to engage her into looking in some of the issues that had brought her to self-mutilation as a very maladaptive way of coping with some of the difficult feelings that she was experiencing. We introduced DBT skills, and we tried to work with her to help her face her traumatic experiences. In fact, the personal protective equipment that we were sharing with her were something that we had to, in a way, find that she was the first one that obliged us to go into a transparent mask and trying to find a way to show our own facial expression so that she could share with us some of the things learned from Melissa was also that the distancing and the fact that we were moving and we were keeping a certain, physical distance and also visual distance seemed to be actually comforting for her. And it seemed to allow her to disclose more than she had in the previous center from which she was transferred to us. So we were able to take full advantage of her long stay and to the 2 weeks stay obligatory because of her COVID status, and her suicidal ideation subsided. She was able to control by herself her self-mutilation during her stay with us subsequently, and finally she was discharged to the care of her psychiatrist. I don't know if there are any comments or questions or anything that you would like to discuss about cases that any of you might have seen that they may resonate with the situation of Melissa. And if not, I will continue. I have another case of another boy who was in the spectrum, autism spectrum disorder, but maybe I will try to finish some of the information that I have for you, and we can discuss it later. So nobody's going to forget their birthdays during the COVID year. Everything was different. But from the very beginning, we noticed how some of our children and adolescents were actually mostly worse and very much affected. However, occasionally better. And this is the bit of a silver lining that we have on this study that was published last October last year. And it is a Canadian study, actually, that considered in which about 70% of children and adolescents from 6 to 18 were worse off in at least one area of mental health. For children between 2 and 5, a little less were worse off in at least one area. And about 20% of children and adolescents between 6 and 18 did better in at least one area. Is that surprising to you? In fact, what is interesting is that the pandemic and the means that we used with the long distance homeschooling or the long distance schooling, we realized that there are children and adolescents who suffer in the school environment or in their social environment. The ones who were bullied, the ones who find themselves marginalized, the ones who find themselves as victims often of abuse by other children, they were actually comforted and they did better. And there are, and this I think is for us a very big lesson. Not one size fits all. There are things that we can and maybe we should do about this population and to help them, better cope when we start again, and now that we start opening again. We need to protect them. And we do have some better idea today who are those children who actually do better. And for the young ones who did worse, they did not do as bad as the older ones. And that again has something to tell us about the relationships that children have in their household and how that is important. If you have any comment or anything to add to that right now, with pleasure, please just unmute yourself and interrupt me. It's not a problem.
I'm just thinking about Melissa. To me, it almost sounds like her admission to the hospital for COVID protected her or gave her a reprieve from her home situation, so that her psychiatric symptoms actually improved in that setting.
Yes.
So it sounds very similar to what you're saying here. Sometimes COVID may have been like what uncovers the underlying problem, which is their situation is not ideal.
Yes. You're absolutely right. There are, and we see that, and this is why I showed you our data for eating disorders. We have a big center for eating disorders, but we never had so many eating disorders ever. And I think it is quite significant because we see the relational issues are the ones that are bringing the youth in. And I think this is very significant for us in many ways, as Orthodox Christians as well, because our faith is based in a personal relationship with, our Lord and Savior, Jesus Christ. Everything we see and we live is very personal. I don't know if Carly or Sarah, if you had something.
Well, no, I was just going to say, in addition to my work as a chaplain, I also teach musical theater, and I have a bunch of little, adolescent students. And one of my friends who is an unusually sensitive and thoughtful, interesting child, and she was 12 last year, and she welcomed being homeschooled or doing school from home because she felt like all my friends are getting weird and bullying me, and some are caring about boys, and I don't want that right now. And I mean, it was really interesting for her. It felt very safe. It felt much safer than being at school and trying to navigate like some really difficult dynamics of being an adolescent.
I also saw, Lila, the kids in my practice who really struggle in public school found a reprieve. They all went back in the fall or in August this year, and so the reprieve for them is over. And I agree. We have to figure out a way to identify these children and set up systems for them. Parents can't stay home and many parents can't stay home and homeschool. and we don't have the virtual school system prepared for children at home. But there has been a number of children who got a reprieve and then went back, and we're seeing a resurgence in, school avoidance and phobias and panic attacks and insomnia. And yeah, we're seeing it come back. Yeah.
Yeah, I think it is very, very significant, and we have to do better than that, because if countries that have the means don't do it, who is going to do it? I mean, we understand these issues, we have them, we bring them on the surface. I guess I have like multiple papers and presentations on that particular issue, because I feel very strongly about that. We have to do something. We know it is not working, and it is not going to change unless we all press together and we push our governments, and we ask that they look after children and adolescents. They are our future. If we can protect them and ensure resilience and make sure that they are doing well, we will have more healthy adults, and we don't contribute to their vulnerability. Thank you. So I have here, a survey of the American Psychiatric Association, like the very serious impact on mental health, which went up about to 64 or something percent from 37%. That was, the issues about mental health. And 53% of adults with children under the age of 18 were concerned about their children's mental health. Almost half of them said that the pandemic had caused mental health problems for one or more of their children. 1/4, 26% of parents reported having sought or currently seeking professional mental health help for their children due to the pandemic. And a lot of them reported having difficulty scheduling appointments. Again, the accessibility in the system, because suddenly everybody is overwhelmed and there is not enough. Now, more than 2/3 of children and adolescents have experienced a deterioration in their mental health. Deterioration of depression was higher in children 10 to 12, the very sensitive age of transition, the pre-adolescent years. What Sarah, you said earlier, like this phase where some of them move into the puberty and adolescence very quickly, and others naturally are not as quickly. And this is a difficult time. Deterioration in anxiety and irritability higher in 6 to 9, where the insecurities, they are related to the home environment and what is happening. Dad's lost his job, mom's lost her job, financially we're not doing well, they're overburdened. The anxiety, the irritability, the anxiety which transforms to difficult behaviors. ADHD, hyperactivity, obsessions and compulsions higher among adolescents, 13 to 18, who suddenly are cooped up. And believe me, one of the most challenging cases I had during the pandemic was an adolescent with OCD, severe OCD, and fear of contamination, whom we had to treat with exposure on the ward, while all of us, we were completely covered from our heads to our toes with personal protective equipment, and we were trying to convince him to touch the garbage can because germs are not that dangerous, but COVID is. So you can imagine, the sort of the scenarios that we had there. Very difficult because it sort of comes to touch all our vulnerabilities. For preschoolers, it was less likely to experience deterioration because for them, the change was not as radical. They were already in an environment in which more or less did not change very much. Their distress came from the distress of the family. Hence, the resilience of the family, the presence of the family, and something that in big cities everywhere in the world, but I think especially in North America, we face a lot, there is the absence of the nuclear family and the sort of the enlarged family. There are no grandparents around. There are no uncles and aunts and cousins to sort of stabilize the environment. We're very much, nuclear families. One person is absent. You lose all this sort of security net that should be around. So school-age children definitely were mostly impacted by the pandemic. And the greatest stress was related to social isolation. Back to the symptoms of the eating disorders, when these adolescents who already had problems with their parents, and these parents who already had problems with their adolescents, around control issues, around relational issues. How do they negotiate how much freedom you let somebody have and how you let them go and how much you keep them? This obviously deteriorated because during the pandemic there was no other safety areas where you could go. If they were from morning till night in the same place and in the same space, sharing in space in which there is already conflict, of course it got worse. Of course, the only area in which an adolescent is going to exercise their control is going to be what they can put in their mouth or not. So in general, we had symptoms of social anxiety, learning disability, and everybody who was more vulnerable in social interactions, kids with ASD, with autism spectrum disorder who are high functioning, they did a lot better. However, irritability on somebody with ADHD or ASD who was used to get out, to play sports, to have plenty of activities, all this was lost. So those are the kids that did worse. So their response is actually based on individual rather than diagnostic differences when we go on one-to-one. And we need effective interventions to mitigate the escalation of symptoms and prevent further distress. And this is where I think that also as Orthodox Christians, we have a role to play, because in this we are in the relational level. We have a deep understanding. And we have an understanding of the family that can actually be very protective. This is our latest statistics from Quebec that shows you that, in fact, in terms of COVID, this is the 0 to 9 right now. This statistic is from Quebec, the COVID victims, the new cases, as of 2 weeks ago. So you see that under 9, 23.5% are under 9 of the new COVID cases, and 15.3% are between 10 and 19. So more than 35, close to 40% of the new COVID positive cases are actually under 19. So no wonder, we have the ones who get sick are younger right now. And what do we want to have learned from this pandemic? We want for these babies not to have to wear, a transparent mask. We want a better future for our children. And the pandemic will go away, will finish. Maybe not as soon as we wish, for sure not as soon as we wish it to, but it will finish, it will be over. It taught us that, there are a lot of things we can do with telehealth. There is a lot of things that we can do in distance, which may be more healthy and more helpful for our patients. There is therapy we can do in distance. There is, follow-up for medication that we can do, but there are things that we cannot do in distance. And the physical consequences will go away to a certain extent as we discover more and more, but there will be mental health consequences that we have to make sure to minimize. So at this point, I would like to, open, if you want to, open your microphones and discuss together, the role of the school, the role of the family, the role of the church. how do we help our children and our youth to face what is left of the pandemic, the consequences that the pandemic has left for them, and where do we go from here? And I have only a few couple of, proposals after that. And but I would like to very much, share with you and hear your opinion. I will see if I can open the chat to have it on the screen as well. So you can probably see my screen. But feel free.
You can see your slides still. Do you want to leave them up?
Yes,
Okay.
yeah, I can leave it up. And thank you, Linda. I see here, I don't know, from Saskatoon, another fellow Canadian. Can you see the message? Okay. Yes, I think we definitely have to find a way to help these children. I'm hoping that in our system we have done we have put forward recommendations to our Ministry of Education to see how and what could work. Because I think the work that teachers did and everybody did during this pandemic was quite amazing. People worked extremely hard to make sure that we would offer the best. In fact, I will show you some of the measures that we had proposed, supporting the use of public transit, the practice of walking and cycling, increase safe accessibility to parks and green spaces as much as possible. I have to admit that it would have worked better in Phoenix than it worked in Montreal because of the weather, but we did our best under the circumstances. And trying to disseminate information on psychosocial support and everything that could be accessible with hotlines, with digital technologies. We had in my hospital, we put up on the Facebook, a page asking, that people could ask their questions if they had mental health questions. I know that other hospitals did something very similar. There are established peer support programs and self-support initiatives, and those are quite significant. I think they helped young students. Another major issue that we discovered, I was talking about telemedicine earlier. We saw again the social disparities. Families that didn't have access to any device, or families who didn't have access to internet. So yes, we can be available for therapy or for evaluation or for school, but if they don't have the means, what is happening? So we have to make sure that we do something about that. That there is nobody who does not have this access, or who does not have, it's a basic right to be educated. And of course, psychoeducation of children, adolescents, and families to make sure that we improve their social interactions, to maintain a consistent routine and structure. That were some of the resilience issues that we have seen, and there are also in the literature. Promote face-to-face, the schooling, especially for those for whom it is helpful. I leave the exceptions aside. Ensure access to mental health care. It also became very obvious for the ones who did not have access. The psychiatrist or the psychotherapist or the therapist, the physician might be available, but the family may not have access to that. Provide support and respite to parents, vaccination. Not everybody had access right away within different waves. And we know that depending, on the neighborhood, depending on the means, a lot of people react to vaccination. Some people don't don't feel or don't understand, or they're misinformed. All those are very important issues, and they are social issues, but they play on mental health. They have a major role for mental health. So at this point, I would say, how do we go forward? And I think all of us, the first thing that we do is to accept the challenges, to recognize our limitations, to be humble as to what we can do and how and to whom, to take care of ourselves and our families, because the biggest burnout that we were talking with Carly earlier that we have is in mental health people who work in mental health. You know, I in all my career, about, almost 30 years now, I have not seen so many people burnt out from the mental health, from our work. And I understand it. It is very, very difficult. So we have to, just like in the airplane, we have to first put a mask on ourselves, take care of ourselves and our families, and empower parents and families, just like we try to empower each other. Model ourselves resilience and adaptability. And what we all did already, experiment and innovate. I mean, it is crazy the things that we can do, the masks we created, how we use the old cellophane from the old transparencies to, create protective equipment and all the, we can do amazing things. The things we did in telemedicine, the games we played in telemedicine, we've never done it before. And this is why I said, play hide and seek, because it felt like a hide and seek with our patients. And the most important that I don't have here, pray. Because I think for us, it is the most important we can do, bend the knees at the time of our difficulty, both personal and professional and collective. And search the strength in the community and in the parish, as we do in professional communities, to move forward. So thank you very much, and I would love to, share, if you want to share your comments.
Thank you, Lila. Thank you so much for a wonderful presentation. So we just have like 2 minutes left, but I'm so thankful to know that there are people like you doing this work, and to know that there are wonderful people on this call and those that will see your presentation. So I just want to thank you. I mean, it's so funny. You said play as the other thing. I mean, so a year ago, last fall, we had outdoor masked, City of Somerville soccer. And it truly felt like it was like the only thing that was remotely normal for these 7-year-olds was to run around, and play soccer with masks, outside. So it was okay. But it was it truly felt like a sacred event every time we got together. And I know we all felt that way. And so just trying to be gentle with ourselves, I think it's just so important. And to try to do the fun, whatever fun things we can do, to try to do them as much as we can.
Thank you.
I see Mother Catherine wrote, her experience with new clients suffering in depression and anxiety tend not to factor in the COVID era stressors. And sorry, I spotlighted myself for a second. And they think it's just them. So this will help her further to normalize the distress. And Linda Funk said, thank you for all this and for ending on a positive, practical note. God bless you.
Thank you very much. It was a pleasure to share with you today. Thank you.